Hi, it's Lauri Kane from the Plastic Surgery Office of Dr. Dean Kane in Baltimore, Maryland. I'm going to talk about the different facelifts that the terminology that people use, like mini facelift, lower facelift, facelift versus neck lift. And so it's very confusing because different doctors, different patients want to call it different things. In our office, we pretty much have two levels of facelifts. We have a facelift where primarily you're dealing with the face. That is where you're having the jowls. Your neck is in pretty good shape, so you have a pretty good contoured neck, but you have a little bit of skin, but it's the jowls and your nasal folds, so it's this part of the face that's really bothering you. And that's where we call it the facelift, where we just are doing an excision from the temples inside the ear and around the back of the ear. And then Dr. Kane is doing what's called the smash facelift. And he really he's redraping the skin, but he's also bringing the muscles of the face up into the cheek and giving you this very pretty cheek. So he's bringing back, he's lifting up the jowls, the cheeks that fell into the jowls, lifting everything back up under the skin, and then removing the extra skin, and then just removing the extra skin off the neck as well. Now he does do what's called the suspension suture also as part of his facelifts, where he actually does a suture from ear to ear to give you this very nice tight neck. And so that would be what would be considered the facelift. Face and neck skin all removed out of the one incision back here. The next level up would be the face and neck lift. And when we say neck lift, in this case, we're talking about the platysmoplasty, the platysma muscle. So he's doing what's called a platysmoplasty. So it's an excision right along here. And this is when your neck is really creating the bands, a lot of banding, or your neck is really full. He does a little lipocontouring, and then he's bringing the neck muscles together and resuspends those muscles from ear to ear, plus that suture suspension technique. And then he also does the smash facelift as well. So that's the full, what we would call our full face and neck lift. And then everything gets, again, the incisions are the same excisions inside the ear, behind the ear, except you have this one incision now to deal with the neck muscle. And so that's really our two distinctive face and neck facelifts, face and neck lifts procedures. And I personally had my facelift and neck lift done 6 years ago. I still love that I did it. I really am thrilled, and I'm happy to talk to anybody who is on the fence about what they should do. It is a very do I do it? Do I don't do it? It is a difficult decision, and so I'm here to help you make that decision. And happy to take a look at any of your pictures if you want to just send me photos. I've been doing that quite a bit to give you a sense of what you might need. All right, I'm happy to talk with you anytime. You could call us at 410-602-3322. And definitely visit our website, drdeankane.com. You'll see all his before and after facelifts. And he does a beautiful, beautiful natural facelift. You'll be thrilled.